So as we enter the late February to mid-April, early May, I commonly refer to this season as sneezing season. We got lots of mold developing underneath the snow as it melts. The wind will kick it up, and then we also have a lot of our Wisconsin plants blooming in the area that can cause a lot of allergies. But today we're going to go a little bit deeper than just allergies, the common immune response. So when it's more intense than just itchy eyes, runny nose, potential sinus infection, we're going to talk about mast cell activation disorder. Mast cell activation disorder is kind of in its early infancy stages in terms of being recognized by the medical community and having a kind of clear guidelines on how to treat it and even diagnose it. It was really just first postulated as a potential disease with common etiology and symptoms by pharmacologists at Vanderbilt University back in 2007. So very, very recent in terms of its name even being in the medical community as a concept. But it is gathering steam. There is, in 2010, there was a diagnostic criteria code added to it, which makes it possible for insurances to cover it, to bill for it, also opens avenues for research as well. So at this point you might be asking yourself, what is a mast cell? And that's M-A-S-T as in tango, cell. It's part of the immune system. It's considered a sentinel cell, so it's going to be expressed primarily in organ systems that interact with the outside world. A lot of mast cells are active in our skin, throughout our digestive tract as well, because that's considered the outside world. They're sentinel cells that will basically release immune modulators when they encounter foreign objects that it views as a pathogen or something that can cause disease. Allergens are recognized by these mast cells as pathogens, and they'll release a number of chemical mediators, most notably histamine, which we know being involved in allergies because antihistamines are used for allergies. So when this histamine is released, it's going to act on local tissues, increase blood flow, which is one of the reasons why we'll see a lot of itching and expanded blood vessels, so we'll have swelling as well. It's primarily to the skin. When I think about, like, especially children with allergies, they get the allergic shiners, so their eyes are all puffy and swollen. You can definitely tell when a kid is suffering from allergies. But what if the body was having that reaction in tissues throughout the body? So we're going to cover a few different organ systems that can be affected by mast cell activation disorder, which is part of how it becomes very difficult to identify and treat, because a lot of these symptoms you might not necessarily connect to histamine or allergens. So the first organ system I want to cover is dermatological, or the skin. So this MCAS released of histamine is going to not just cause itching, but it can actually get to the point where patients can experience like burning sensations that can be difficult to parse between that and like true nerve pain. We can have a lot of chronic flushing, so with that vasodilation, we'll get lots of redness in the face, which can also contribute to that burning sensation. Antihistamines, we know, can help with breathing. Patients with asthma, if they have chronic allergies, when those allergic symptoms increase, they can actually develop difficulty breathing because of hyperresponsiveness of the airway and then increase in mucus of the respiratory system. So some patients with MCAS may notice like a chronic dry cough or difficulty breathing when their symptoms are exacerbated. With this vasodilation, we can also see basically vasomotor symptoms. So that vasodilation is not just located in the skin, it can actually affect our larger blood vessels and actually contribute to symptoms of low blood pressure or changes in position. You can see that. It's called orthostatic hypotension. So changes in body position resulting in big drops of blood pressure, which can contribute to dizziness, even like potentially falls. Histamine release has been postulated as another mechanism that can affect a lot of our autonomic nervous disorder systems, such as POTS, which we might do another series on that at some point. That's a big subject to cover, but right now we're going to stay focused on mast cell activation. I touched earlier on the fact that not only is the skin one of our primary organs that's going to have these mast cells, but also our digestive tract. So it's not uncommon for patients with mast cell to have lots of gut issues. So whether it be chronic constipation or diarrhea or pain upon eating things, could be related to histamine release and the inflammation that can kind of follow. Another common symptom is going to be neurological, so we can see brain fog being really, really common, difficulty sleeping, chronic fatigue. So we've kind of covered a lot of different symptoms of MCAS. In the coming weeks, I'm hoping to dig a little bit deeper into diagnosis, because there's a lot of labs that can be done, but they can be a little bit tricky to parse out. Histamine release can be a very labile system, so someone that feels like their MCAS is terrible at the moment, we might have missed the window to draw labs that are really going to reflect the fact that, hey, we just had a ton of histamine get released in the system. So we'll go over that. There's a few different things, and also treatment. So there's a lot of different either lifestyle changes, supplements, or even prescription medications that can be used to help control or push the MCAS symptoms into remission a little bit. So keep an eye out in the next coming weeks. We're going to keep posting videos, try and focus on diagnosis, treatment, lifestyle changes, have lots of ideas of ways that we can help you. If you know anyone that feels like they might be having symptoms associated with MCAS or mast cell activation disorder, feel free to share this video with them, and if they need more information after that, they can always give us a ring.